When you hear the word hypnosis, you probably think of a crazy man dressed similar to the one in this picture who's going to try to alter your state of mind. But there's actually a whole lot more to it. In this short video, we're going to explain to you the common myth of clinical hypnosis. Clinical hypnosis is actually just a practice used by practitioners using the connection between the conscious and unconscious mind to help patients suffering from depression, phobias, OCD, anxiety, and many other neurological or psychological disorders. We caught up with Dr. John Avery to ask him a few more questions about clinical hypnosis.
Well, my name is John Avery. I am a licensed independent clinical social worker. I received my master's of social work from the University of North Dakota.
Why do people seek help with clinical hypnosis? How is it better than therapy?
Well, clinical hypnosis is not a therapy in itself. It's a treatment option. It's part of therapy. People seek out clinical hypnosis, or it's suggested in therapy as an intervention to help with many various different issues: depression, anxiety, stress response, post-traumatic stress, acute stress, stuff like that.
Okay. How do you use hypnosis in your practice?
Mainly in my practice, mainly in therapy with different clients, depending on issues that they face. The largest portion is anxiety, dealing with anxiety, panic, and in some cases, fear of doing things like fear of flying, or fear of social interactions, stuff like that, and then also the trauma.
What type of reactions would you say that you get from patients, such as negatively reacted?
I've had a few clients who, during the start of the hypnosis process and during the induction and going into the deepening phase, they panic. And in clinical hypnosis, the toughest, or the people that struggle the most with reaching that comfortable, relaxed state and deepening, are those that struggle with obsessive compulsive issues.
How do you feel clinical hypnosis has an effect on people and benefits?
The way I view clinical hypnosis is it's kind of like cognitive behavioral therapy on steroids, meaning that you can address the persistent thought patterns that people experience. You can address those through clinical hypnosis, and they have a tool to reach that calming state so they're not triggered, and they're able to achieve the ability to address the triggers that they're experiencing without having the heightened sense and without engaging in the triggers or feeling the physical symptoms that they experience.
How do you compare clinical hypnosis to Freud and his work?
Well, Freud's work, I believe, he had a whole framework of how he viewed treatment, and like I said earlier, is clinical hypnosis isn't a therapy in itself. It's just one little tool. But with Freud, he had his theories on the brain and stuff like that. And in hypnosis, clinical hypnosis, there's the theory of the conscious mind and the unconscious mind, and addressing the way those two interact. Where Freud had the id, the ego, and the superego, and their effects on people's interactions in the world. So, there's probably similarities, but I don't think clinical hypnosis is such a broad framework such as Freud's work.
How would you say it is related to psychology?
Definitely, it's related to psychology in that it's a treatment intervention used to help people who are struggling with psychological issues. So yeah, that's the relationship to psychology, and it's just a way to learn how to deal with triggers, emotions, symptoms, stuff like that. And those are all definitely things that in your psychology class you're learning about.